Hello, I'm Dr. Andrew Safer with Carolina Foot Specialists, and we're here today about 2 weeks before the Cooper River Bridge Run. And what I'd like to talk about today is ball of foot pain, which is a really common condition that I see this time of year, especially a month before the race. So what I'd like to talk about today is what patients feel like when they come into the office, some of their symptoms with ball of foot pain. I'd like to talk about two specific types of ball of foot pain, one being capsulitis, the other being a neuroma, and then talk about ways that you can alleviate some of the pain over the next couple of weeks to get you ready for the bridge run. So it's a little challenging for me to actually bring my foot up to the actual screen to show you where people that come into the office have these specific ball of foot pain issues. So we're going to pretend today that my hand is my foot. So if this is your big toe and this is your second toe joint, the area where we typically see capsulitis is the base of the second toe. So if you can imagine, there's a capsular structure that connects the base of your second toe to the metatarsal bone. And this capsule can become inflamed from repetitive pressures. And so when people come into the office and they're experiencing pain in the ball of the foot in this area, they usually feel like they have, or they're running on a rock or a stone. They'll have swelling in that area, and it really affects their running. The second common ball of the foot condition that I see is a neuroma. And basically it's an inflammation of a nerve branch that runs on the ball of the foot. If you can imagine, this is the base of the third and fourth toes. Typical pain is right below that area, and this is just kind of showing you that the nerve is a little inflamed below the skin. And so basically what people would feel like when they come into the office with neuroma symptoms would be burning, tingling, and numbness. And a common complaint would be if they feel like they have a sock bunched up in the shoe. And it usually feels better when they take that sock off or shoe to give them relief. So those are two common conditions we see on the ball of the foot. So what really contributes to some of that ball of the foot pain? Well, a lot of times we'll see people that come into the office that have been really ramping up their running over the past month or two. Maybe they haven't run as frequently over the past few months, and they may be running every single day or overtraining and increasing their mileage, maybe doing several runs on the bridge. And these repetitive pressures can cause an inflammation on the ball of the foot. And if you combine that with possibly a running shoe that might be worn, maybe it's 8 months to a year old, and that shoe may have lost some of its shock absorption capacity, that can contribute to increased pressures on the ball of the foot and inflammation. And so the question is, what can we do to alleviate some of those symptoms if you're experiencing these over the next 2 weeks to get you ready for the race? Well, the good news is there's definitely hope. And the first thing we want to try to do is reduce inflammation. The best ways to do that is ice and anti-inflammatories, maybe after your runs, taking a frozen gel pack or a frozen bag of peas and icing it for 5 or 10 minutes. Epsom salt soaks and warm water is very helpful to reduce inflammation, and anti-inflammatory medication by mouth. In addition to that, we want to try to offload that area to take pressure off. So basically, these are some pads you can get either over the counter or in our office. They're called the metatarsal pad. They're very adhesive. And basically, maybe during the workday, you can place this below the ball of the foot where the pain is, maybe below the capsule and below the nerve, to essentially offload that area, and that will allow that area to heal. I don't really recommend these types of pads to run with because they won't stick as well, but they're very adhesive to wear like during work or around the house, especially if you have hardwood floors. Another type of pad is a metatarsal pad that actually sticks to the insole of your shoe, the footbed, or the orthotic that you may have. In the same concept, if you can place that pad below that area, that's going to help to offload that area when you're running and therefore decrease pressures. Another thing that Dr. Brown talked about last week is maybe alternating your running cycle over the next week or two. Maybe running every other day or giving it 24 to 48 hours to rest to allow some of those soft tissues to heal. Maybe do a little bit of cross training such as spinning or biking just to allow that area to heal and rest for a few days. And then as things are feeling better, you can start to ramp up your miles a little bit before the run. The other thing would be shoes, making sure that your shoe is not clearly worn. If it's older than 8 months to a year, you may want to replace it. It's not too late. Maybe getting a little bit of a wider toe box to accommodate for the neuroma symptoms, and maybe adding more shock absorption to the ball of the foot with specific running shoe types. One running shoe that I really like are called Hokas, which are nice type of running shoe that takes pressure off the ball of the foot. And the other suggestion I would say, especially if you have hardwood floors around the house, would be UFOs. I've used those a lot. I've told patients a lot about these over the past several months. It's kind of like a combination flip-flop sandal bedroom slipper all in one. And they're very cushiony and nice to wear around the house, especially during the summertime. So in this review, if you have or are experiencing ball of the foot pain, it may be a neuroma or capsulitis. The ways that you can reduce the pain is ice and anti-inflammatory medication. Offload it with the metatarsal pads. Maybe change your running cycle a little bit over the next week or so. Maybe run every other day. Take a look at your shoes. If they're a little older, possibly replace those. It's still not too late. So hopefully those tips will help you if you're experiencing ball of the foot pain. I appreciate you listening today. Next week, we're going to talk about another common running injury, which are ingrown toenails and other pesky toenail issues. Thank you.